I'm Dr. Minnie Somasundaram. I work at OhioHealth Riverside Methodist Hospital. I'm Tanya Singletary's physician, and I performed her robotic laparoscopic hysterectomy.
My name is Tanya Singletary, and I own a marketing consulting firm. For the past 20 plus years, I worked in the pharmaceutical industry. I have had fibroids for the past 40 years. I always knew that I would eventually have to have a hysterectomy. I had really bad periods, and I just learned to really adjust my lifestyle. When I became pregnant with our daughter, the fibroids grew as Ashley grew.
African American women in the United States tend to have a higher propensity towards fibroids. On average, 40 to 60% of women have uterine fibroids. What we find in our African American population is that they tend to have heavier bleeding, larger fibroids, and tolerate their symptoms for a significant amount of time. Tanya came to our office as a referral from another physician. Tanya had been dealing with her symptomatic uterine fibroids for a significant amount of time. She had already undergone a prior procedure called a uterine artery embolization, and despite that, her fibroids were still pretty large, and she was having many symptoms associated with it.
It's been about 10 years that it was recommended that I have a hysterectomy. I put off having my surgery because, like most women, I had a career and a family, and I really did not want to spend 6 to 8 weeks recuperating. I continued to put it off until I relocated back to the Columbus area because I had family that would be able to take care of me.
As a patient comes to our office and is a candidate for a hysterectomy, we evaluate them for single site versus multi-port based on their individual symptoms and individual issues. Although single site is a great advancement, it's not necessarily perfect for everybody. We have to make individual determinations based on the patient's situation and her symptoms. Because of the size of Tanya's uterus and the complicated nature of her fibroids, we elected to do a multi-port hysterectomy for her.
What Dr. Minnie shared with me was that the recuperation period was 2 weeks, which was music to my ears. She also said that because it was minimally invasive, that I would have very little scarring.
One of the reasons I'm very passionate about minimally invasive surgery is that as a busy mom and a physician, there's so many things that I'm juggling in a single day. If I'm dealing with an issue that's slowing me down, I don't want to take a lot of time off. It's become a little bit of a mission that I advocate for women having access to options that allow them to get back to their daily life much quicker.
My experience at OhioHealth was fabulous. The nurses were kind and attentive. The staff really answered any questions that I had. My life is back on track. It's back to being very busy. It was the right time to have the procedure done and the right hospital system, OhioHealth Riverside. And I put my trust in Dr. Minnie, and it was fabulous.